Dear friends, I'm Dr. Bose. I'm a senior consultant pulmonologist practicing more than 2 decades in southern part of New Delhi. I run a foundation, SANS Foundation, which is a globally recognized foundation, and also I work for different corporate hospitals, National Heart and Fortis. Also, we have recently started a post-COVID rehabilitation center in one of a leading hospital in South Delhi, the Sama Hospital. Dear friends, my experience with these respiratory patients, mainly in asthmatic, is very vivid and very, enhancing. Let me tell you, the 4% of the population whom we see in our clinical practice are asthmatics. And these asthmatics, they start suffering very early in the childhood. And many of these asthmatics, they go back to worse. And significantly, I've seen that many of the asthmatics, they have requiring their inhalation steroids more frequently. They have severe nighttime symptoms. They have very poor daytime control. They have frequent hospitalizations. Their consumption of oral steroids are very high. And many of these patients, they are very young. They have developed steroid complications in the form of osteoporosis, hypertension, steroid-induced hyperglycemia. I call these patients are really difficult asthmatics or severe asthmatics. Now, the science says that asthma is not just one disease, you treat them all with inhalation steroids. So you have to clinically differentiate different subtypes of asthmatics. And as we say now, the science says it's not like one suit fits all. You have to clinically differentiate different asthmatics because every asthmatic has different pathophysiologically, biochemically, and biologically. So the asthma which I'm going to talk about is an eosinophilic asthma. It's not so uncommon, and many of my patients are eosinophilic asthmatics, and they are very high level of eosinophilia. And these are the patients. They have all the symptoms of severe asthma, which I mentioned, and they get hospitalized very frequently, and their quality of life is so poor. So we are really have been struggling to control their asthma with all kinds of possible permutation combinations, but still they go back to worse. Thanks to the new science, what you call the biological science, the biologics are playing a very important role. Now we have got very interesting biologics available, and we have set up a biological clinic in one of our centers just to sensitize people. These people can be really be helped by the targeted, delivery of drugs because now the biologics can really take care of the specific subtypes of asthma, what we call the severe or difficult asthmatics, and they can bring down the eosinophilia practically to zero. Now we have those solutions. So, my dear friends, if you are an eosinophilic asthmatic, if you are requiring your inhalation dose, oral steroids, getting more frequent hospitalizations, have difficult nighttime symptoms, poor quality of life, morbidity, and really you have all those problems, mood fluctuations and weight gain and all, please come to us and for a follow-up, and we'll assess you. You may be those candidates who need biologics, and we can help you out. And who knows, you may really come out of your difficult symptoms, and you can have a symptom-free life. So the way forward is biologics in these difficult aspects or severe asthmatics, and I'm sure with the right kind of approach, with the proper scientific evaluation, these eosinophilic asthmatics can be very well treated with the right kind of biologics. So if you need any queries, text me or call me, visit our website www.sansfoundationindia.com. You can note down my number 9810159687. You can just text me or send an audio. We'd love to help you out. Take care, stay blessed. Regards, Dr. Bose.